Okay, hello everyone, this is Shane Lee, and thank you for your time to watch this video. So as I mentioned and announced in the email, we found that there are the big warnings of the big snows in the Pennsylvania and the East Coast of the United States, and there are many expected the risks of the electricity blackout and the internet connection interruptions. So I decided that instead of canceling the class, but because some institutions such as the University of Maryland and other colleges, they cancel the both in-person and the online courses because of those expected delays or the interruptions of the connections. So but instead of the canceling the class, probably the having asynchronous course would be better because we can utilize our time, and maybe you can watch the video later if you experience any kind of the internet connection interruptions or the electricity problem or any kind of problem caused by the weather hazard. So I will upload this video on the website, I mean on the YouTube, but I will add the link in the Moodle. But you will be expected to watch this video by this Saturday, for example, and then I will add more extension for your assignments. I mean the readiness assessment paper 3, which was due this Sunday, and also the writing assignment 1. I decided to give you more time. So the new due dates of those two assignments will be next Tuesday. So you will have 2 more days on that. So in the following assignments, like readiness assessment paper 4, maybe we will just keep the same. We will just keep the original due dates, but based on the needs, maybe we can discuss about that. But anyway, let me just cover on the topic of today, which is the social determinants of the health, which means how the social factors and how the big social and the macro factors impacting the individual and the country or society level health is. So we covered a lot so far around the perspectives based on the simple interactionism and the functionalism. But it will be probably the first time to read the article or the cover the article based on the conflict theory, which means the social system and exploitation of the richer people or the higher class people. The exploitation of that system would be the problematic. So this is the consistent with the views of the conflict theory. So I will mention about that and introduce about that theory during the class. Okay. So this is my home, what I am seeing outside the window, and this is so a lot. So that will be very big if you need to commute or if you need to carry your family members, for example. So that's why we are keeping that as asynchronous just for today. But next Tuesday, we will come back to the synchronous meeting. So no worries about it now. All right, so first article is the distinguished professor Vincent Navarro in the Johns Hopkins University. So he's very famous and a very big name in the medical sociology and studies about the topics of medical sociology. So main summary of this paper is about what are the matters. So what are the matters of the inequality of the health? So in many common sense, in many statements, people say that the inequality issue. So inequality is the main basis of the health inequality, or the inequalities are the main cause of the disparities in health and also the mortality, for example. But he addresses that surely inequality matters. However, those who benefit from the inequalities, I mean in the macro structure and in the hierarchy, who already has or in the higher top positions who can determine the policies, they are more responsible. And those kind of system these are more responsible to the death or the losing the health and the health inequality issues. So it's blaming the structure and also the blaming the existing pre-existing structural problems. So that will be very consistent with the views of the conflict theory. And also criticize neoliberal policies, focusing on the more market condition, the interests or the market-centered policies, because it's decreasing the protection of the people or the decreasing the policies and the expenditures in the health, because they believe that they should follow the economic conditions, I mean the market conditions. For example, the motivations of the markets and interests of the market, and also the decreasing the interventions of the policies and the government. So as we discussed in the class before, maybe probably more interventions and less interventions. These are very controversial issue. So this is very consistent and very continuing topic in every kind of articles in the medical sociology, because we care about the inequality of health based on the social conditions. So he will be a part of the description and part of a discussion in terms of the conflict theory and blaming the neoliberal policies in the United States in the globalized world. So so my daughter is here checking out my pronunciation. Sorry about that. Right, so this is the depiction of the neoliberalism. So neoliberalism is very prevalent in United States and other all countries, at least in the capitalist countries. But the communist countries war had been in the communism economic systems, but even the communist countries like China and other, maybe Soviet Union, now in this case Russia, they are also following the liberal regimes of the economy. So maybe neoliberalism is very prevalent system in the world and in the whole world and the United States at least. So these are mainly focusing on the effects of on the market, and these are decreasing the funds by the government, because these are based on the market condition and the interest of the market. So it is very trying their best to decrease the rules or decrease the controls or decrease any limitations, because they believe that the economic goods and the economic system and the goods of the economic system will benefit everyone. Even though it benefits more the richer people, the benefit got the richer people can go down to the lower classes. So there is the trickle down impact in theory, but we will cover that why this is not very realistic in the real examples. Again, neoliberal ideology are mentioned in the article. The reducing the public responsibility and the controls and interventions. These are the main characteristic of the neoliberal ideology. So it's increasing the choice and the basis on the choice of the market, and instead of the national-based one, instead of the national or the government policies in the healthcare system, they prioritize the insurance-based one. Not the government insurance, but very private insurance ones, based on the medical care, not that will be not national care, the private one. And health promotions are responsible by individual behavior changes. So that is more the blaming the victims. It means that if they are very sick and if they are suffering from the health inequalities, it means that they are responsible. The individuals are responsible, not the government and not the market, not the social macro factors, because they can change their behavior and they can endeavor to earn more to get more the better insurance, or to be the capable of the paying more money for the healthcare system. So these are all very consistent with the neoliberal ideology for that. And also the trickle down effect, which is kind of the in theory, the water comes down from the high part to the lower part. So the richer people, it's very natural for them to gain more wealth or gain more benefit for the richer people or the higher class people, and then their more gained benefits or the gained wealth are coming down, coming down, and more on benefits by their investment, because they got more in this system. They can invest more, and then those invested goods in social macro in total general, they will in that total wealth level will benefit whole the people in that country or the community or states, at least in the minimum. So low skilled workers and the increase of tax revenues and more so they will be the basis of the better policies, and the multiple effect of the increased spending. So more spending will stimulate the economy in the United States, for example. So this will be the very ideal system based on the neoliberalism and neoliberal system. That more gains for the richer people that will benefit the whole people in that country or in the world. So that's the theory of the trickle down effect. You may know that why that is not very realistic. So as you can see, the United States is here. Even though the Brookings, the research institution that is very conservative institution, it shows that it's at the progress, but it still shows that that is averagely very maintained. So at maximum by the conservative view, United States stayed the same. So even though average Gini decreased, the United States has very similar level. But more from other sources. So within country inequalities, because they are mentioning about, the richer people. So they say that if the richer people gains more, the gains of the whole country will increase, and then the benefit, even though the benefits are more centered from the richer people at the beginning, and that we spread out in the whole country. But we can see that in North America, the United States is considered as very, very unequal, one of the most unequal country or society in the world, based on the Gini index in the world by the World Bank. So based on their perspective that impact on their interpretation, so based on the World Bank, the United States has very unequal distribution of the wealth. So that will be very contrast to the trickle down effect. So still there is very big inequality based on the World Bank data, but the Brookings one, they say that the United States stayed just same. So based on the perspective, we can have the different interpretations. Anyway, so another source, this is also the World Wealth and Income Database, which is very similar with the database data used in the Brookings Institution. But it says that this is the very strikingly the U shape. It means that there was some decrease of the share of the wealth by the top 1%. In the purple color is the United States and their fluctuations, but there was a decrease in fact by 1980. But it's increased again and again, and now in these days, top 1% share, top 1% gain, and just obtain 20% of the whole wealth in the United States. So that will be very big inequality in the United States, and you can see that United States has very high share of the top 1%. Top 1% people would have the bigger proportion of the wealth of the total wealth of the country. So you can see that in various sources, even though there are some discrepancies of the findings, still United States has a very big and high level of the inequality, at least for the wealth and the income. And we could see, so maybe we can compare the countries, for example, more developed countries and the less developed countries in terms of the health level. But very serious problem, at least in the United States, is within country. So within country inequality is very big issue in the United States. For example, the general wealth level. So based on general wealth level, it is very clear that United States is a very wealthy country. And naturally, the health level of the United States is super better than the general and the average level of the health conditions of the Bangladesh or less developed countries. However, the people, I mean the very vulnerable people or very marginalized people, for example, the African Americans in the Baltimore and maybe the less paid job workers in the Baltimore, they have very endangered health conditions compared with the Bangladesh. Even compared with the less developed country, their health level is worse than those less developed countries. Surely, the poor people in less developed country people, they would suffer more. So that would be very natural. But still, within the United States, we need to remember that there are the group of the people who are suffering from the health condition problems or health disparities. And we can know that these are the Baltimore, a very impoverished little area of the neighborhood, and there are very less developed and less occupied by the social policy. But we can see very wealthy counties and the wealthy communities, they enjoy more the more longevity and the better healthcare system. So it may sound very unnatural because who have more, they have the right to pay more and to enjoy more on the better healthcare system. However, if some proportion of the vulnerable group are suffering too much, suffering a lot, and if they are endangered, even though whatever they try, that will be a big social problem in that country or in that society. So anyway, in that liberalism policies and the liberalism regime, states are losing their control and the motivations of the interventions because they believe the market condition and the individual behaviors and the individual changes are responsible to their health conditions. And the stimulated economic growth didn't improve the health conditions, unfortunately. So that's why the liberalism has very bad outcomes. 1 million people lost their health insurance every year. That's very big. 1 million people are getting into the very endangered status of that, losing their healthcare services and risks of the bankruptcy if they are sick. So, for example, if they get infected by the COVID-19, if they don't have the health insurance, they may not be able to go to the hospital to get cured. It means that their choices will be just staying at home or just wait to death if they are in very serious situation. So in this type of the work-based, the work-related illness, and also the general level of inequality, these are increased a lot under the system of the neoliberal system. So that will be very big issue in the United States and all other countries in the neoliberal regime as a neoliberal economic system. All right, so because if the video is too long, sometimes it has some error, I will stop the first video here, and I will see in the next part of the video. So I will cover more about the interventions and other types of the social factors in the next video. Okay, thank you for your time and see you in next video.